Hi and welcome to my channel. My name is Kim Ramirez and I am a certified speech language pathologist in the state of California, and I am also a licensed and certified auditory verbal therapist, and that's a therapist certified to work with children with hearing loss, hearing aids, and cochlear implants as well. And I'm here today to talk to you about developmental milestones. And what a developmental milestone is just like a benchmark of what children should be doing at what age. And so I'm going to break it down for you. I'm going to do a little series. Today we're going to start with 0 to 12 months. And I'm not going to get too much into tips and how to help them. I'll do that in separate videos, but today I just really want to talk about the nitty-gritty and the benchmarks of what children should be doing at what age. And I don't want you to get overly concerned if your child's not doing all of them. If they're doing about 80%, that's totally good. If they're doing 0%, that's something you need to think about asking your doctor about, or your pediatrician, or you can schedule a phone consult with me and we can go over it. And so I want to talk to you. We'll break it down 0 to 3 months. We'll break it down in little increments. And I'm going to talk to you about what they should be doing receptively, what they should understand, and that's comprehension-wise, and expressively, and that's the sounds that they're making and the words that they should have by the time they're supposed to have spoken words. So we'll just get into it. So for 0 to 3 months, for receptive language, so that's again comprehension, they should be responding to sound by smiling. They can have a bunch of different reactions, but just responding to a sound, like a dog barking. They could smile, they could still, they could stop, sucking on their bottle, they could startle or eye widen, and some kids are going to start turning their head by about 3 months and trying to find out where the sound's coming from. Forgive me also for the airplanes overhead. And they also can recognize their familiar caregiver's voice. So the cool thing is, in the womb at 20 weeks, babies can actually, their cochleas, their organ of hearing, is fully developed. So they can actually start hearing and even learn to tell the difference between certain things. So by the time they're born, like even newborns, they can recognize mommy and daddy's voice. They can recognize even familiar books or songs that they heard when they were in the womb that were repeated over and over. Which is really cool, some of the studies that have come out. Also for 0 to 3 months, for expressive, what sounds they should be making. They should be making cooing sounds, happy sounds, kind of gurgling sounds. We're not expecting them to make like consonant sounds like a or an ah sound quite yet. They could be crying for different needs. So they'll start to, by 3 months, they'll start to differentiate, like have a hungry cry or a tired cry, and it'll kind of sound a little bit different. And occasionally they might respond vocally to you talking to them. Like if you are talking to them, they might coo or give you like a ah sound in response. Now at 3 to 6 months, they begin to attach meaning to sound. So they recognize that it was a dog barking. Maybe they look for the dog, or they recognize, that it was a doorbell, or they look for mommy's voice look for mommy when mommy's talking. They also start to recognize their own name, not consistently, but they start to, and they will like respond differently when you're calling them specifically. They also start to listen to their own voice, which is really cool. They also start to find where sounds are coming from, so they can tell if a sound is above or below or behind them. They can tell the difference, discriminate between angry and friendly voices. So they might cry at an angry sounding voice or smile at a friendly voice. They also search for sounds that are out of sight. So if they hear something behind them, they'll look around for it. If they're not doing these things, hearing loss is the #1 cause of speech and language delay. So it is important to get your baby's hearing tested. Luckily, the United States has a universal newborn hearing screening. So before your baby leaves the hospital, they do a little hearing screening and you'll get a pass-fail. If you do, or pass-refer. So if you do get a refer, it is important to follow up with your audiologist as soon as possible, ASAP, so that you can get that hearing testing done and know that if there's any hearing loss that we might be working with. Sometimes it's fluid, and sometimes it's more objective hearing loss that we need to address. Expressively, what they should be doing at 3 to 6 months is vocalizing for needs and wants. So they're starting to whine, not just cry, but also whine or kind of vocalize for their needs. They'll vocalize in response to singing, or they might sway back and forth. They start to play with their mouth. They start to blow raspberries, like, and they start to maybe yell or play with their volume or their pitch. They'll vocalize by themselves or with others, and they might kind of just vocally play with their tongue. They often laugh, make the ah sound as in car. They also make sounds pretty often. That's why like mama is typically, one of the first sounds that they make. And they also will often mouth toys to explore. So, it's common and normal for babies to put just about everything in their mouths. It's how they learn and explore. If they're doing it, beyond 2 years old, let's chat, but under that, we're pretty good. Okay, so for 6 to 9 months, receptively, what they should be doing, they should start to actually recognize family member names. So you say, "Where's Dada?" and they look for Dada. And they often will turn to their own name. They should be really recognizing their name by 6 to 9 months. They should understand commands like no or wait, or like don't touch that. It's pretty common. They also respond often to gestures. They have emerging like greetings, hi and bye, and sometimes you say bye and they just do a little hand gesture of some kind. But it looks like they understood you, right? They understood that we do this often. We say bye. They often appear to listen to conversation. They also enjoy music and singing. And then for expressively, what they should be doing, they often, at 6 to 9 months, we really see the emergence of babbling. And so they might babble 2 syllables together, like baba, papa, mama, dada, or gaga, if they have a G sound already. They can also imitate some simple sounds and number of syllables used by others. So in auditory training for kids with hearing loss, we often teach them, they're called learning to listen sounds. So like we teach them all the sound effects, like ba goes with a sheep, or moo goes with a cow, or buck, buck, buck goes with a chicken. And we notice that some of the first things that they can do before they can actually imitate you clearly, you say buck, 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 and they say buck, buck, buck. Before that, you go buck, 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 and they'll go like they're imitating your pattern. Or you say moo, and they may go or so they're imitating like the pattern of your syllables. So that comes first. They'll also shake their head no. That tends to come out at this age. They might try and sing to themselves or sing along with you. They often participate more in like pat a cake and peekaboo type games. They might try and like cover their own head with a blanket, or cover your eyes or cover their own eyes, or kind of initiate by like hiding behind the chair. They also can be using the sounds P, B, M, and D. Okay, moving on to 9 to 12 months. So for 9 to 12 months, receptively, comprehension-wise, they usually understand the command give me. So, and that's with holding the hand out. They're also by 12 months, they're starting to understand commands without gestures. So you can say, where is something, and they look around. They understand the where question. They understand come here, don't touch that, put that down, or give me the specific thing, or where's your blankie, things like that. They often start to dance or move to music and recognize, music versus talking. They often understand common questions, like the where questions, or do you want more? They enjoy looking at pictures typically, and listening to little short stories. And expressively, what they're doing is their babbling becomes more complex. So they're often babbling with inflections similar to adult speech, and we call that jargon. So what that sounds like, I'll do my best impression, but like bada 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 bada. So they're kind of mixing the consonants that you're using, and it sounds a little bit more like conversation, although it doesn't have quite meaning yet. And actually, closer to a little bit between like 12 and 18 months, you'll start to see they might do that and throw a word in there, bada bada wah wah, or bada bada da da. And they often also are imitating noise in simple words, like you say woof woof, and they try to imitate you. They might initiate a game, again, sorry for the plane. Initiate a game such as peekaboo, like again, they might hide behind their chair or something. They often might talk to their toys or others, and just kind of with that babbling, they're just kind of recognizing, okay, this is this communication thing, I can do this too. They are merging their first words around 12 months, between 9 and 12 months, such as bye-bye or mama, something simple or more. They often also use the consonant sounds P, D, M, and B. And don't freak out if they don't have all those sounds yet. Again, the benchmark is kind of 80%, if they're doing kind of 80% of these skills in that age range, or by the end of that age range. For example, for 9 to 12 months, they're doing 80% of those skills by 12 months. Then we, don't have too much reason to be concerned. If they're doing 0 of those skills by 12 months, it's time to talk to your pediatrician or give me a call. Okay, I hope that was helpful, and stay tuned for more videos. Have a good day.